our launch webinar for National Brain Awareness Week. I'm Mags Rogers. I'm CEO of the Neurological Alliance of Ireland, which is the national umbrella for 40 charities supporting people with neurological conditions and their families. National Brain Awareness Week is coordinated by the Neurological Alliance of Ireland every year to raise awareness of the brain and brain conditions and to highlight the need for greater investment in both services and research into neurological conditions. My colleague Sinead Bradley will speak shortly about Brain Awareness Week and what's happening and how you can get involved. But I just want to say a few words about our main awareness initiative for Brain Awareness Week this year, which is entitled My Neurology, Nurse and Me. This awareness initiative follows on from the launch of the first postgrad diploma in neurology nursing recently in February in our CSI. And it aims to raise positive awareness and recognition among neurological patients, families, and the general public of the vital role that nurse specialists play in delivering essential care to people with neurological conditions and their families. Research carried out both internationally and here in Ireland shows that neurological patients under the care of a specialist nurse have better knowledge and understanding of their condition, are supported to identify problems early and seek appropriate care, and enhanced confidence in managing their condition and their psychological well-being. Family carers highlighting the importance of the nurse specialist in reducing burden and increasing knowledge and confidence in managing the needs of their family member with a neurological condition. Specialist nurses improve the effective delivery of healthcare services by helping to reduce waiting times, prevent unnecessary hospital admissions, improving patient flow and improving continuity of care across the health system. The My Neurology, Nurse and Me campaign is led by the Neurological Alliance of Ireland and its member neurological charities working in conjunction with the Irish Neurology Nursing Forum. The key elements of the awareness campaign include video testimonies, patient education webinars, feature stories in print and radio, and information graphics highlighting the positive impact of nurse specialists in promoting better outcomes for people with neurological conditions and their families, as well as effective and streamlined delivery of neurological care. We're delighted to be joined this morning by specialist nurses Orla Russell and Emmett Kelly, and also together with Lisa, who will share her own story of the difference it's made to her having a nurse specialist as part of her care. So I'm going to hand over to my colleague Sinead Bradley, who's going to talk a little bit more about Brain Awareness Week and just how you can get involved and how you can find more information about the week before she then introduces our first speaker. Handing over to you, Sinead.
Thanks, Mags. Just give me 1 second, guys. Good morning, everyone. Welcome and happy Brain Awareness Week. As Mag said, Brain Awareness Week started today. It takes place all week, so March 16th to 22nd. And it's amazing to see already such activity across and content across social media and websites. So Brain Awareness Week is amazingly, we're 21 years in the making now. So it's been around National Brain Awareness Week since 2005, and NAI has led the way in coordinating the week. We're delighted to be supported this year by over 50 patient groups, patient advocates, research groups, and the much wider neurological community. Together, with their support, we'll be raising awareness for the over 860,000 people currently living in Ireland with a neurological condition. Brain Awareness Week every year is our annual awareness initiative, which aims to promote a greater understanding of the brain conditions, as well as the much needed need of investment in services, research, and prevention. So, what have we got going on throughout the week? We have a jam-packed week, which has kick-started this morning at 8 a.m. and will go on right up until the 22nd. We have most of our information you can find across all of our social media pages. So we're very active on Instagram, Facebook, Twitter, or X, and now TikTok. And of course, we have a dedicated webpage on our website, nai.ie. So throughout the week, you will find various personal stories, video testimonials. I support Brain Awareness Week video series we've got throughout the week and in the lead up to Brain Awareness Week. We're delighted to have MEP I Support Brain Awareness Week videos. We have numerous brain fact flyers going out across social media, brain tips, infographics, and so much more throughout the week. So if you are looking to find out a little bit more about the week, or you're looking to download your own materials and get involved throughout the week, on our website, nei.ie, we have a Brain Awareness Week information pack, which is jammed packed with downloadable materials and resources that you guys can use yourself across your social media pages or websites, or what a lot of people are doing with numerous information stands that are happening around the country is all of our materials are printable, and they're printing them out and highlighting them across universities, schools, hospitals, all nationwide. So we've Brain Awareness Week information pack, which is full of fact flyers, I support flyers, social media profile pictures and cover images, Zoom backgrounds, event calendars. It's packed with everything you need to get involved throughout the week, starting today, as I said, until the 22nd of March. So how you can get involved, simply go in, as I said, guys, to download on nei.ie. So there's a dedicated web page on the website. Follow the conversation throughout the week. We will be very active throughout the entire week on nei.ie, on Instagram, on Facebook, on TikTok, and X. It's never too late to organize an event. We have a lot of events going on. We have webinars, we have information stands, coffee mornings. And also, guys, maybe get political or raise awareness with it's an opportunity to raise awareness with your elected representatives. So also today, as Mags mentioned, we're delighted to start our new awareness campaign, My Neurology, Nurse and Me. And we're even more delighted to have 16 partners on board supporting the campaign. So our list of partners are many of our NAI member groups, as well as some pharmaceutical companies as well. So there are a list of companies there, our partners there, which again, we have a dedicated page on nei.ie, and this will be going out across all of our social pages, which has already started this morning. So the campaign, as Mags has already mentioned, will shine a spotlight on the vital role of the neurology nurse specialists in supporting people with neurological conditions. Across the week, as well as all of our Brain Awareness Week activities, so it's a bumper-packed week this week, we will have information and educational video series, which is a conversational piece with nurses and people with neurological conditions. And at the end of today's webinar, we're actually going to be showcasing one of those videos for you guys. We have a whole series of specialist nurse fact flyers going across our social pages. Again, as I said, we've got the dedicated page on nei.ie. There'll be national, local coverage, media coverage, educational webinars and online events. Patient and nurse stories are being shared across all of our partners' social media pages and websites. As I said, we've got 16 partners that are on board with ourselves. And our awareness raising content across social media, we will be using the hashtag My Neurology, Nurse and Me. So follow the conversation throughout the week for both Brain Awareness Week and My Neurology, Nurse and Me. Use the hashtags, tag in NAI, tag in our members, tag in our partners, and let's get the word spread out there as much as we can. If you need any more information, my email is sbradley@nei.ie, and I can send you out any of our information tools, video series, fact flyers, anything that's needed. And that's all. And again, happy Brain Awareness Week, everyone. And it's great to see the campaign launched. Today's the launch day of our My Neurology, Nurse and Me, which will continue well beyond Brain Awareness Week. Thank you, Mags.
Thanks, Sinead, for that. I just want to hand over to our first speaker this morning, Orla Russell, Advanced Nurse Practitioner for Huntington's disease. And Orla is fresh from RT Radio 1 just now and joining us. So welcome, Orla.
Hi, thank you. Yeah, just straight off the radio. I think I have a slideshow there as well.
Do you want us to share, Orla? Are you okay? Okay.
Is that okay? Or
Just give me 1 second, guys. Just bring it up now.
Yeah.
Okay, Orla?
Thanks so much. Yeah, hi everyone. My name is Orla. I'm an advanced nurse practitioner in Huntington's disease and Beaumont Hospital, and I'm just going to speak about the role of the neurology nurse. So a nurse specialist is someone who has an area of expertise in a specific area of healthcare, such as neurology. It could be Parkinson's, epilepsy. There's a vast cohort of patients within neurology. So for an advanced nurse practitioners, we're educated to a master's level in advanced practice, which means that we're autonomous practitioners within a clinical governance structure within our hospitals with the consultants that we work closely with. And then for clinical nurse specialists, they are educated to postgraduate degree, and they also have a wealth of experience in their chosen areas. And we all work to a level of advanced decision making within our care for people living with neurological conditions. So I took this from the Advanced Nurse Practitioners Nursing Board guidelines. This kind of covers what is in our role and what we do on a day-to-day basis. So it goes over the 6 domains that we incorporate into our day-to-day jobs, and it also kind of states at the bottom kind of the other stuff that maybe patients and family members don't see what the neurology nurses do. So we also are very prevalent in creating services within a hospital. So within that, there's a lot of structures in place, such as developing policies, developing memorandums of understanding, developing caseloads and the inclusion exclusion criteria within that, and the governance for our practice within those structures as well. So there's a lot of extra work around it outside of the patient facing aspect as well. Go to the next slide. Thank you. So advanced practice nursing is based on several key domains, such as I said before there. So we have professional. I think there is a black square on the screen there actually. Is everybody else seeing that too? Okay, so the several domains such as professional and clinical leadership, research and evidence-based practice, educational and professional development, also management of our. Is there something we could potentially do about the black squares that are showing up? I think people are asking about it.
Just give me 1 second. I'll stop the share and put it back in, but it's fine on my end, or just give me 1 second.
I think people
Just
in the
let me
chat.
know if it can.
Sorry.
Yeah, it's still there for some reason. It's just moving around.
Is that are we okay now? Well, it's fine on my end here. I can
See if I can share it from my side.
would you mind, or it's sorry everyone about this. It's fine on my end. I'm looking at just give me.
Sorry, 1 second.
Just while you're doing that, Orly, do you want me to try one last time just to see?
Yeah, I'm just trying to see if I'm able to. Oh, there it is. There. Can you see my screen?
Just try one last time there.
Yeah, we can see that there
Yeah, we
now.
can see your screen fine.
Yeah, so if you just want to work your way through.
Perfect. Sorry about this. Okay, so yeah, so advanced practice nursing is based on a few different key domains. So the first one being clinical practice. So that's what we do every day when we see our patients. We're providing advanced healthcare assessments and full episodes of care. And then within professional and clinical leadership, research and evidence-based practice, education and professional development, management and team competence, and leader and professional scholarship. So within clinical practice, like I just said there, we're providing advanced clinical assessments, delivering expert patient care, managing complex healthcare conditions, and using evidence-based tools to do so. And we're also continuously monitoring and evaluating our patients' outcomes. Within the professional and clinical leadership domain, we're providing high standards of clinical practice. We're supporting quality and safety in our patients' care. And we have to act as a clinical expert within our teams so that if any of our colleagues needs advice or have queries about a certain condition, they can come to us and ask them those questions from us. We promote best practice guidelines, and we are advocates for our patients and for the services that we develop for our patients as well. Within research, it is part of our roles to conduct research in order to be able to improve services and and support innovation within healthcare. It is sometimes difficult to incorporate this into our role, but it is definitely a necessary and important part of our role as well. We act as educators, and we provide professional development to our colleagues as well, not only to our patients and the families that we meet. We also educate within our multidisciplinary team. We teach and mentor within our profession as well, our fellow nursing colleagues, and we support learning and development within the healthcare team. And for ourselves, we also continuously engage in professional development to make sure that we are also in line with the best clinical standards that are available to ensure that our patients are receiving the best care. And we share this knowledge within our teams and within the patients we care for and their families as well. So within management, well, we work within multidisciplinary teams. Well, majority of us, we hope to, if those multidisciplinary teams are available, and we promote safe care environments for our patients. We participate in risk assessments, and we do audits on our services as well to make sure that they meet requirements. And we improve care coordination. So often the time, the nurse specialist is the person who coordinates the care, does onward referrals, and they're often the people that they'll link back in with to provide updates on how the patient and their families are doing. And again, we support service initiatives as well. And often we are the people that are scoping the services and trying to understand the gaps and seeing how we can improve on those gaps moving forward to improve services. We act as leaders as well in our profession. So again, like leading and developing on improving services. We participate in policy development. We try to identify the gaps and implement change, and we try to be that leader within the hospital environment, but also within the community, and again within politics as well, trying to advocate for our roles and for our patients. I guess this iceberg analogy is kind of good because I think the tip is what we kind of see nurse specialists do on the surfaces, and that's the most important part of our role, engaging with patients and families. But there is a lot that we do in the background as well that isn't as often seen. So that's me. Thank you very much.
Thank you so much, Orla, for that. It's a really comprehensive overview of what a nurse specialist does. And great reports coming in on your interview this morning and RT Radio. We'll circulate that since the recording becomes available. Orla, I just had one question that we received just before the webinar, just how people can access the service.
So there's different avenues for different services to access them. For my service, we do have a phone and an email service. Majority of the time, well, for referrals into our service, we accept referrals from any healthcare professionals within the community and GPs. And then once we have them set up within the hospital, we can engage with their care wherever the need is. So if the person is in the advanced stages of the condition and perhaps can't travel to the hospital, we can arrange to go out and see them within their homes or whatever living arrangements they're in. So it's just on a need by need basis, but we accept referrals from anywhere in the community into our services. But if prior to even getting that referral, they can make phone and email contact with us.
Super. And just one more question, because I'm conscious you're wearing two hats today, that you're the education lead with the Irish Neurology Nursing Forum. Could you just maybe just briefly give a little bit of detail about the forum and what it does, what it's trying to do to raise awareness and develop neurology nursing in Ireland?
Yeah, so the Irish Neurology Nursing Forum is a group of specialist nurses in neurology in Ireland. The whole concept of the group was for us to be able to collaborate and share knowledge and share experiences and build on that as a network together, because it's really important in neurology because we're all kind of separate within our disciplines and sometimes can be quite siloed in that we have that network just within our own profession so that we can support and help each other. So it's been very good in that regard. We do have a very good network of people, and for neurology nurses to join, they can join via our website. And once you do join, you have access to a lot of policy documents and education opportunities, and also just kind of networking as well. So I guess building on from that, we have every year we kind of have a different goal. One of them was for education around neurology. A lot of us have to go abroad to get our specialist knowledge in formal education, and most recently, the postgraduate in neurology was brought into RCSI, which is fantastic for neurology nursing moving forward, and that we have that formalised education here in Ireland. So yeah, and just to promote our roles and kind of, promote the succession of neurology nurses moving forward, and the fact that we need more, and kind of just to make neurology attractive to other nurse specialists as well, that they consider it as a speciality moving forward as well.
Super. Thank you so much, Orla. And we're delighted to be running this My Neurology Nursing Meeting in conjunction with the Irish Neurology Nursing Forum. And as Sinead said, we have 16 other partner groups, including a lot of our member organisations. Thank you so much, Orla. You've had a busy morning. I'll move on to Lisa now. Lisa, if you want to introduce yourself.
Hi, my name's Lisa Whelan. My main focus here today, I suppose, is I'm a person living with epilepsy. I was asked to come on here. I'm an advocate for Epilepsy Ireland, and I do an awful lot of media volunteering. I am a media volunteer for Epilepsy Ireland, and I've done a lot of advocacy work with them. Primarily, I'm here to kind of talk about the my neurology nurse and me, because of my experience with when I was having my children. I have four beautiful daughters. They're not too young now, but when I was having my children, my first baby, well, it was 24 years ago when I was pregnant. Myself and my husband, not going into the whole, I have epilepsy since I was 18. That's when I took my first, or when I had my first seizure. So my seizures were very, very far apart. So I didn't feel between myself, I suppose my partner at the time, but he's now my husband. We decided that, look, medication wasn't the route for me at the time, because my seizures were like, I took one and the next time I took a seizure was 4 years down the line. And this is just individual to me. So anybody who is experiencing seizures or anything like that, don't take this as the way forward or anything like this. This is just individual to me. So for me, it was the right route to take. We went on to decide to have children, and this was why I felt, and my husband felt, that we didn't want to go the route of medication. So I didn't, which was fine. We managed the seizures, they were so far apart. So when I was pregnant on my first baby, I was told or I was asked, the usual questions that you're asked at your antenatal appointments. And one of the questions I was asked was, have you ever had a seizure? And I said, yes, I have epilepsy. And they said, all right, so a box was ticked. And I was never asked anything. And they asked me, was I on medication? And I said no. So I think that was yes, that's great. There's no medication there, so we don't have to worry about the unborn baby. So that was fine at the time. There was never any more reference made about it at the time. Now, we do have to bear in mind that this was 24 years ago. Louise is going to be 24. My daughter is going to be 24 now in August. So it was a long time ago. Um, so that was fine. Perfect pregnancy. Nothing went wrong. I had no seizures during my pregnancy. I had a perfectly healthy pregnancy. Louise was born. I was induced. She was late. I was induced, and had her, held her in my hands for 2 minutes, and if even, and I wasn't even 2 minutes, and I handed her to my husband. And as soon as I sat back in the bed, I had a seizure, and all hell broke loose in the delivery room, as you can imagine, and that was fine. I was looked after. The hospital looked after me very well and looked after Louise very well. They actually took her away and minded her overnight that night, and that was fine. So that was all fair and well and done. We went on then to have another baby, a year and 9 months later, and I was asked again the same question, have you ever had a seizure? And I said, I do have epilepsy. I told them the same story. I told them what happened to me on Louise. So they were prepared for what might happen. And again, as I said, they were prepared for it to happen. So there was no big panic, but it did happen again. I took a seizure immediately after delivering Emma, my second baby. She's 21 now, nearly 22. So that was Emma. And on my third pregnancy, which is where the whole shining light came, on my third pregnancy, when I was in at my antenatal class, they said, oh, we actually have a nurse here who's an epilepsy specialist in the hospital. Would you like to have a chat with her? I said, yes, please. Um, I was like, this is the first time that anybody's ever discussed anything to do with my epilepsy. And I spoke with the nurse, and I did actually meet not the actual nurse who looked after me, but a nurse who works with her. And I'm really sorry, but I can't remember her name now, but I know the other nurse is still working. Um, Somewhere on the set. I don't know whether it's James's or Vincent's, but it's somewhere. I met her recently anyway in the RCSI. But she said that when I had my meeting with her, she said, we're going to put a plan in place. She said, when you're in established labour, we're going to give you this medication, and it may just relax your brain enough that you won't go into having a seizure straight after delivery. So I said, okay. But she said, make sure that you tell the doctors and the midwife that this is what you have to do and have it in place. I will make sure that it's on your file now. So that was fine. So that plan was put in place. Now, my third baby decided to come herself on her. She was a very agreeable child at that time, and she decided to come on her day on her own and very quickly. And all I kept saying was, I have to get this tablet. I have to get this tablet. And I told them, and they did actually give me the tablet. And I had Rachel, and I had no seizure. And it was an absolutely wonderful, wonderful intervention that was made for me on that at that time. Because as I said, I have four beautiful children. I went on to have Sophie after Rachel, and I went through the same process. They said to me about the epilepsy. I said, I'm not on medication, but I do have I didn't speak to the nurse on this occasion because I think she had actually left the hospital at the time. Or yeah, I think she had left the hospital at that time. They didn't have a specialist. And I said to them, I do want to have the same plan put in place. So they did. And I got that same tablet. And when I was in the established labour, I said, can I have this medication? They said yes. It was all prescribed, it was all put in place. But only for that nurse spoke to me during my pregnancy on my third child. I would have had that same thing over and over again. And she was the very first person who actually took an interest or took any note of the fact that I have epilepsy, that I have a condition, and that as traumatizing as some labours can be. Now, my labours weren't particularly traumatizing, but some can be. Mine weren't. They were normal, as normal labours can be. But I had reasonably, relatively okay labours, but they were very traumatizing. The first two were very traumatizing at the end when now my husband was very relaxed about the whole situation because he's been through seen me in seizures before, and he was able to tell the doctors and nurse, oh yeah, this has happened before, and she's going to come out of it, and he was able to tell them, no, it's okay, she's going to come out of this in a minute, and then she'd be a bit groggy, and he was able to explain to them what was going to happen. But I think it's vitally important that the neurology nurses are in place and that they do have more neurology nurses. I mean, there's so few that are, and it's not by any means, it's not the nurses' faults that they're not able to be there or they're not able to, be allocated to specific areas and that. I mean, the hospital that I attend on a regular basis now, they have an epilepsy line for, do you have the epilepsy nurse's number? And I'm like, yeah, I do, but you can't get through. I mean, you can get through, but you have to be on it like that at 9 o'clock. And if you don't get through, if so many people get through in front of you, the messages are left and then the line just goes dead and you just have to wait. And it's not even a 5 day a week service because of shortages. So the neurology nurse is so, so important for people like me and for people, and I'm just speaking for people with epilepsy. I'm not speaking about people who have other brain condition brain conditions. I don't know if that's the right terminology, but other conditions that are causing issues or whatever. I'm not a medical person, so I can just say that my condition needs the backup and benefits from the backup of having a neurology nurse because everybody knows it's hard to get a consultant, but the nurses are your constant, that they're people that you can rely on. And they're the ones who got me through having a fantastic experience with my second two babies. I was able to have that bonding experience with them when I was just after delivering. I didn't have that with my first two. Doesn't mean I'm not any closer to them.
But I think it's a
But
great example, Lisa. I think, it's a lovely story because it's a great example of just a simple intervention.
yeah,
And just as you say, when you spoke to me about it, just having a companion on that journey, pregnancy, labor is kind of be frightening enough.
mhm.
But as I say, when you've got those added complications, it's just somebody there that is supporting you through that journey, providing that advice and information and specialist care. So I think your story is a really good example, as you say, of why neurology nurse specialists are vital in neurological
Oh,
care. And just, we do have to be mindful of that resource issue that we always need. We
yeah,
always need more nurses. So thank you so much for sharing your story.
no problem at all. No problem. As I
Thank
said, I
you.
can talk for hours, but I won't. You've more to get on with. So thank you for having me here.
Thank you so much, Lisa. I'll move on to our final speaker. So, Emma, if I can ask you to introduce yourself, and hopefully you can stay on with us, Lisa, for a few minutes. I know you have to get back to work. Thank you.
Hi there, everybody. My name is Emmett Kelly. I'm a neurology nurse. I work in Tala Hospital Neurology Department. and thanks to Mags and the NAI for the invite this morning to talk. So my title is ANP, Advanced Nurse Practitioner in Rare Neurodegenerative Disease. So it's a bit of a mouthful. I prefer to say to patients, I'm a neurology nurse. It's much easier for them to understand. So I'm going to talk just for a few minutes about the type of patients that I see and just give an example of what me as a neurology nurse, what I hope I do to help them and their families. So neurodegenerative disease really refers, as many of you know, to conditions that progress over time and result in the loss of neurons, brain cells, and affect people's motor and cognitive function, amongst other things. So that's a broad description, and it's a huge amount of different neurodegenerative diseases. So my title is Rare Neurodegenerative Disease, but I also see some of the common ones because most of my work is in a cognitive clinic here in Tala Hospital, and I see people in the movement clinics as well. So the people in the movement clinics might have cognitive problems, and the people in the cognitive clinics have movement problems as well. So I'd see people with Alzheimer's disease, and some of them can be older people. They can be under 65. We see people with Lewy body disease, which is not rare, but it's often undiagnosed as well. So they have a mixture of motor and cognitive symptoms as well. So I often describe what I am as I'm a mixture of a Parkinson's nurse and a dementia nurse as well. So it kind of broadly describes what I do. So some of the rare conditions now we'd see people say with hereditary conditions like Huntington's disease, and we see people with frontal temporal dementia as well. So that would be FTD. That's patients who would have speech problems or behavioral problems as well. But a lot of what we focus on as well, and what we're an expert site here well, we hope to be, is with atypical Parkinsonian syndrome. So they're conditions that people start off with Parkinsonism, or sometimes a diagnosis of Parkinson's disease. So they might have movement problems like stiffness and tremor, rigidity, but they often present in a way, or their condition progresses that's not typical, it's atypical. So they may progress faster than one would expect, and they may be falling. They might have symptoms that are a bit unusual, like eye movement problems or speech problems or early kind of cognitive changes. And also they mightn't be responding to the levodopa treatment. So we're often referred people as a second opinion that they may have this atypical condition. So some of those conditions include PSP, which is progressive supranuclear palsy, or corticobasal syndrome, which is similar, and then multiple systems atrophy. So they're conditions that people often, when they come to us, they've already seen several specialists already as well. So they're just some of the conditions that we see. So my role really predominantly, like I said, is in the cognitive clinic. It's mostly an outpatient-based service. So it's really split into two areas. So that's the work I do towards a diagnosis for a patient, and then the follow-up care and the ongoing care that we provide. So often people who are referred to our clinic, I'm the first person that they would hear from, that we like to prepare our clinics, because people are they could be coming from centres in Cavan or Tipperary or all around Leinster or our catchment area. So we want to make sure, obviously the appointment is important to them, it's important to us. So we try to prepare our clinics that we have all of the information. It's obviously very frustrating for anyone if they come to a clinic and the doctor says that they haven't got the clinic letters from the previous doctor. So we always try to make sure. So we often talk to people on the phone beforehand. And then on the day after they check in, I'm often the first person they meet. So I try to put them at ease and their families at ease, and try to explain what's ahead of them on that day. So then I proceed then with cognitive testing. So that gives a general overview of areas of cognition, whether it be memory or language or executive function or visual disturbances. So it can help give a broad overview of where there might be problems. And then we also do a collateral. We like to take a collateral that's very important from the family member. So either I might do that, or maybe one of the neurologists would do that. And then the person sees the neurologist, and we look at scans and we take the history and the examination. So often on the day, depending, there's a huge variety, like I mentioned, with all of these conditions. sometimes we can give a diagnosis on the day, but then sometimes the person has to leave and there might be more testing. So that's again where that point of contact comes in with me, that they'd have my number. Because as we know, like any of us, if we're told information and we leave the clinic, we often forget half of it. And there's a lot of jargon, even though the neurologist would certainly give adequate time, but people obviously can only remember a certain amount of information. So from that point on, I'm a point of contact, because we need to go through a diagnostic journey. They need tests. It might be a lumbar puncture. It might be a scan. So it's really to help support them in during that process as well. And then at the point of diagnosis, then I'm there as well. And then we arrange a post-diagnostic nurse-led clinic for everyone who we give a diagnosis to for all conditions. So this is important because it helps people to come back a few weeks after their appointment where they receive the diagnosis, and we have space and we have time to go through what this means. So try and help people with an understanding of the condition. And in many cases, I might need to go over how we came about this diagnosis. There might be a family member there who wasn't at a previous appointment. So it's really trying to improve people's understanding and hopefully acceptance of the diagnosis as well. And then there's a medication component as well, that people may be commenced on medications, and we want to make sure that they're tolerating them, that they're able to take them, and that they understand the reason for it as well. We really try to help give people some hope. These are progressive conditions, unfortunately, that at this very moment we don't have disease-modifying treatments for. Hopefully that'll change. So we really try to help people in being able to manage the condition themselves and give them some tools and information, and for their carers too. A lot of this is covered in the dementia model of care as well, that people have a post-diagnostic meeting and that a plan is developed as well. So we try to go through what would have been discussed before. So whether that be talking about future planning, like arranging enduring power of attorney, looking at practical steps and practical supports that are out in the community. And then I try to explain to people what my role is and the role of the wider team. So it's really to try to give people that support after a diagnosis. But like I tell people, they can ring me at any time. If they leave a clinic and they need to ring the following day, so be it, absolutely. So we have a telephone line as well for any problems that might come up, any questions. So that's, so often people are told we'll see you in 6 months' time. So it's the ongoing care for people you can't quite predict. So we don't know what's going to happen, how someone's disease may progress. They might need to be seen in 3 months' time. So it's important that they have that point of contact. So they might ring me, and I can conduct a phone review with them or their carer or maybe a healthcare professional that they're seeing. I'm a nurse prescriber as well, so I can change, alter, stop, or start new medication as well, depending on the symptoms. But then I would book people in then, if need be, into my nurse-led clinic, where I can, as Orla mentioned earlier on, I can provide a full episode of care. I would assess their cognition, their movement, their motor symptoms. Also, a lot of conditions have autonomic or problems with managing bowel, bladder, blood pressure control as well. There's kind of a neuropsychiatric or psychological aspects to people's condition. Sleep as well is very important too. So I can assess all of those aspects, also then get information from the carers and support them too. And then we can make a new plan of care. And like I say, I can prescribe some medication that can help treat the symptoms. But then we work as a team very much here. So if there's something that would be, say, beyond my scope, so we all work within a certain scope that we're comfortable with, that if I need someone to be booked in sooner into the consultant-led clinic, well, then we can arrange that. We have an MDT here that if I think they need to see the specialist physio sooner, I can arrange that as well. The speech therapist, a dietitian, social work, and we have a neuropsychologist as well. So all of this helps really to provide timely care for people, while also helping with the waiting list as well, that people are able to be seen and they have all of their care perhaps by a nurse specialist. And then it means they actually don't need to come back to see the consultant maybe for another 6 months. So I was able to provide all of their care. But again, every case is different too. So it's that ongoing care as well that people can phone in. Sometimes people may need some letters done, especially for the rare conditions. They may need me to advocate with local services to provide some education and support as well. And obviously then people sometimes are admitted to hospitals, whether it be here or elsewhere, and that I can see them when they're admitted if need be too. So it's really trying to provide that care throughout all of the stages of their condition. And then unfortunately, as things progress, people's symptoms become more complex, harder to manage, but while at the same time their attendance at clinic is often not possible. So then we would link in with palliative care services. I would often refer people to specialist palliative care services to provide that support in those advanced stages of the condition. And again, we would have that support for those services too, because they may not be aware of how to manage some of those conditions. So we try to provide that advice virtually as well. So it's really throughout people's continuum as well that the nurse specialist tries to provide. So I suppose that's just an example of my role. Like obviously my role as well would have been influenced and supported by a lot of my colleagues as well. I learned a lot from the epilepsy nurses, because some of the people with advanced neurodegenerative disease would suffer with seizures, and I would have had a seizure clinic as well in the past in a previous role. The geriatricians we work with here in Tala, would have learned a lot from them, and the nurse specialists in their clinic and palliative care and in psychiatry. So I think having that learning from other disciplines is very important too. So that's any questions to take.
Thank you so much, Emmett. And I'm always, blown away by just the nature of the role, the advanced nurse, particularly yourself and Orla as advanced nurse practitioners, just the amount of support and services and the range of services that you provide in that role and what you're able to do for patients. That's so important. And thank you. You've given both of you have given a really good overview of that role and the importance of it. And as you say, working as part of a multidisciplinary team. I just see a couple of questions coming into the chat there. Just, I suppose, people are not asking direct questions as such. They're just kind of naming conditions or areas. I'll just, for yourself, Emmett and Orla, someone is asking a question about, I presume they're saying peripheral neurology. I think that's a typo, peripheral neuropathy. Would any of your nurse colleagues deal with peripheral neuropathy? If either of you want to come in on that one.
Well, there is a neuropathy clinic here in Tala Hospital, and we have a neuromuscular AMP who started in the role last year. I wouldn't like to speak. I know there is various neuropathies. There's a huge range of neuropathies, various inflammatory neuropathies as well, that she would cover within that clinic too. So yes, there is a neuropathy clinic in Tala. If they can always contact me through Sinead, perhaps afterwards. There's no problem if they have a specific query.
Or even if they're seeing a neurologist, if that person in the webinar is seeing a neurologist, they might talk to their neurologist maybe about getting a referral to that clinic if that's possible. And then we have a superficial siderosis. Just someone has put that into the chat again, not with a context or anything, but just if that, if any of you want to comment on that.
I know that can be seen in people with, again, just in general terms, with people with cerebral amyloid angiopathy, which people can have little vascular changes and prone to bleeds, and it is but again, be a bit above my pay grade, I'm afraid, to comment intelligently about it, unless Orla has more experience in that.
No, I don't. Sorry.
Again, I think if people, there are more, as you said, Orla, there are more posts coming. There's always more nurses needed, but there are more posts coming on board. So maybe again, for people to talk to their neurologist and just see if there's any specialist support that nurses can provide. Just one question for you, Emmett and Orla, just around the training pathway. Either of you can come in, or both of you can come in here. Just on training opportunities, I know, Orla, you mentioned the postgrad diploma that's just come on board this year, but just what's the typical, just the audience might be interested in knowing, what's the typical kind of career pathway for a neurology nurse specialist and then on to, as you say, the advanced nurse practitioner role?
Yeah, I think typically the way it's been in Ireland is that we've gone abroad and got our specialist education abroad. So, well, my journey has been, I trained in Ireland, when I went to England and then I went to Australia, and I developed a great interest in neurology. Well, in my training I also did, but then abroad as well. And then when I came back, I actually wanted to work in clinical trials, and I worked in neurology clinical trials for a while. I worked in young onset dementia and movement disorder. And then from there, my interest grew even more, and I got to know a few of the neurologists in St. Vincent's University Hospital. And then I was encouraged to do further education. So I went back to Trinity College to study dementia and neurodegenerative disease. Um, and I did a lot of online courses as well over in England. I did a lot of travel to England as well to do kind of different continual professional development, such as injecting for botulinum toxin for dystonia. So a lot of, collaborating with our colleagues in the UK and trying to set up shadowing as well of clinics over there and how they run, and up the north as well. And it's about networking and yeah, traveling for our education. And then I went and did my advanced practice masters in UCD, and I just finished that last May. So then once you finish your masters in advanced practice, you can become a registered advanced nurse practitioner with the Board of Nursing. So that was my journey. And I think typically with neurology, you have experience either whether working on the wards or in outpatients, and you develop an interest with it. And then you kind of collaborate and network and see how other people have got their education and kind of go down the similar path. It is very much about networking, and that's what the Irish Neurology Nursing Forum does, is kind of help support people to develop their continuous professional development and kind of be like, well, where did you study that, and how do I get on that course, and who did you network about shadowing that clinic, and just providing those details and information is really important. So yeah, I think a similar journeys would be, I think, Emmett, what was your journey?
A long journey. Yeah, so when I started in a new role as a general neurology nurse, shared between two hospitals, and there were new roles in both hospitals about 7.5 years ago, I would have been a ward manager, worked a lot with stroke, dementia, and had a higher diploma in gerontological studies. So would have had an interest, but then there was no particular course that I could do, and like that, I had to kind of look at things online in the UK, learn about epilepsy, but there's some very good online courses in migraine. And, so I was learning as I go. So really, this new course is certainly a great addition. I did do a chronic illness management course in UCD, and I focused on neurodegenerative disease, and there was a palliative module in that. So I found that very informative as well. It was a great help. But I think it's not just about the courses, it's about that mentorship, that people who've been down a sort of a hard tested road where you've had to kind of almost write the book yourself, that you then can kind of give people that insight and about almost how to outline your service, how to plan, how to become a neurology nurse. It's the how to do it rather than just going to college, doing a course. It's that practical aspect of being able to build a new role, finding out what it is you need to know, how you need to learn it, and such. So that's why I would have got involved with the INNF as well, because I thought I had that general kind of thrown in at the deep end experience. And people say, oh, that's great, but there's no reason for people to have to go through that again if other people have done it, and they can give that insight, I think. So yeah.
Absolutely. So I just want to thank all of our speakers this morning for just giving that fantastic overview, Lisa, of very direct experience of a difference having a nurse makes to that experience of pregnancy and labor. I think it's a really, really good example of just where a nurse stepped in and changed a journey for you. And also to Orla and Emmett for just giving that really good overview. And just to say that our campaign, our My Neurology Nurse and Me campaign, runs for Brain Awareness Week all throughout this week. And that's really something that we're trying to do. We're trying to increase patient and family awareness of what it is that a nurse can do, how important a specialist nurse, access to a specialist nurse is in their care. And also for the general public, for policymakers, just that increased awareness of neurology nursing, the need for more investment, need for development of career pathways, straightforward career pathways for the likes of Orla and Emmett and their colleagues. And we're delighted to be working, as I say, with our partners and with the Irish Neurology Nursing Forum to bring this campaign to you throughout the week. I'll just pass briefly over to Sinead there because we're going to leave on a lovely note. We're going to try, hopefully, if our technology supports us, to just show one of our promotional videos for the week as well.
Thanks, Mags. Yes, and as Mags says, fingers crossed this works for us, guys. If not, we have a series of 3 educational informative videos for the My Neurology Nursing Me campaign, and they're available as and from today on our dedicated webpage on nei.ie, and they've already started being posted across our social media platforms. So fingers crossed technology works, and apologies, Orla, for earlier. So here we go. So do let me know if you can't see it. Just give me 1 second.
My name is Orla. I work as a candidate advanced nurse practitioner in neurology in Beaumont Hospital. I work with Huntington's patients. I provide clinical expertise, person-centred care and education to families of people living with Huntington's disease. With one of those people being Bernie's husband, Michal.
I met my husband at a bus stop in Lucan. My sister introduced me to him because she knew him, and I was smitten from the time the bus pulled in to collect us. 2 years later, we got married in Rome, and life was great. Like any married couple, we were making lots of plans and dreaming about the future.
For my role, no day is the same. I could start my day off with doing a phone service with a patient who lives in rural Ireland and managing their symptoms remotely. I could then go to a nurse-led clinic where I see patients who are in the early stages of this condition and provide education and support for them.
The elephant always rose his head and said, what if? And the what if was, if Michal had HD, he had a 50% chance of inheriting it. And unfortunately, the dice didn't roll in his favour.
It's really important that the family and that the person themselves living with the condition have constant access to a neurology nurse. A big part of our role is to listen, to advocate, and to educate families and carers who are helping somebody live with this condition.
We went through a period of grieving together, but then you have to carry on, you have to bring the kids to school, you have to do homework, get the uniforms ready, go to work yourself, all of that while carrying this huge load.
For many carers, it's important to know that they can pick up the phone and speak with somebody who understands the condition and understands what they're going through. It's not just about the clinical care, it's about the continuity and compassion provided by neurology nurses.
Thankfully now, there is a neurological nurse for Huntington's disease, and this is great hope for us moving forward, that there will be somebody who understands the disease, somebody who's at the end of the phone, because emotionally for the whole family, it's very, very stressful.
There are currently 800 people living with Huntington's disease in Ireland and approximately 3,000 people at risk. Patients and families living with this condition deserve better care. They deserve more neurology nurses.
I often remember just thinking, you know, every week I lose a bit of Michal. So it's constant loss. Luckily, we have Orla. We need more nurses.
Right, thank you everyone. And I say those videos are available on our website, and you can see them on social media throughout the week, along with lots more. A lot of our campaign partners have developed their own videos with neurology nurses, so there'll be a lot across social media all this week. So again, I'd like to thank all of our speakers this morning and acknowledge all of our campaign partners, and we look forward to sharing My Neurology Nurse and Me with you all throughout this week. Thank you.
Thank you.